What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering how often do you get called back to the emergency room to the ER when you're out on the floor doing morning reports on night shift duty. So to give you context, I'm a night shift tech, Xray tech, do 7 on 7 off, and I dabble in day shift because I work a lot of overtime. So one of the joys, if you could call it, of night shift is morning portables, which is a set amount of x-rays, usually chest x-rays, some KUBs that have to be done before that lovely day shift crew gets there, or else they get mad, and so do doctors. So that's something that will always be sprinkled into your shift. You get it done when you can, 12 a.m. to 5 a.m. usually. Patients love it, getting waked up in the middle of the night for a little 30-second x-ray. So, essentially, with the time, you'll notice certain hours are more notorious for patients to come in or traumas to happen, so you kind of develop your schedule of when you go to the floors. But what happens is, it's when certain patients code or certain nurses or doctors put in certain stat orders that you're forced to go outside of your routine time that can kind of cause you to be a back and forth to the floor. Occasionally, if you know something's going to happen, you might have to wait until you shoot it before you go, just because once you go on the floor, you'd rather not get everything than to keep on coming back and forth. I would say if there's a trauma, depending on what level of trauma it is, what's going on, sometimes they'll call you and like, hey, we have this going on. Probably in X amount of minutes, you'll have to come to an intrusive chest x-ray. So you're like, okay, bet I can do this before I have to come down. Occasionally, if it's something simple and basic, we'll just send one tech down to go shoot it, and I'll just continue shooting stuff on the floor, and they'll ask me, hey, where you at? And I'll tell them, and we continue finishing it off. Sometimes something is like major, it's like a level 1 trauma, it's a lot. We're like, we gotta go. Stop this, it can wait. And we just chug away and just do that and then run back. The number one, regardless of why would we drop in traumas, post reductions, and then rapid response are the top reasons why we would have to constantly going back and forth. And yeah, it's been your boy Miguel. See you on the next one.